Guys, it's me again, Chelsea, birth doula and hypnobirthing practitioner. I am here today to talk about 5 questions that you should absolutely ask your doctor or midwife early in your pregnancy, or at least during your visits with them, definitely long before you're in labor. Number one is intermittent monitoring. You want to know the policies not only of the hospital, but also if your doctor can override anything that is a norm for the hospital. So say the hospital says, oh, all of our patients come in, you go into triage, you get about 30 minutes on monitors, you get a cervical exam, and we decide if we're going to admit you. Then you move into your room. The standard protocol for a lot of nurses is to then keep you on the monitors until you're all checked in. You get your blood work done, you get all of that. If you come in very active labor, as doulas, we sort of try to push that 20, 30-minute strip in the beginning is enough. So then once you're in the room, you can move around, you can be doing what you do. Sure, draw some blood, whatever you need to do, but I still want to be active. The difference with this is that a lot of these protocols can be shifted by your doctor. If your doctor says, hey, once I have that 20, 30-minute strip, I'm fine. She can move. She can do whatever she wants at that point. Some hospitals have wireless monitors, and that's what they use for everyone. Some have wireless that are tucked away, and they only use sometimes. You want to be really clear on what type of monitoring has happened. Is happening in each hospital. I've walked in and had hospital protocol be across the board. We don't let anyone off monitors, and I've had doctors override that. I've also had across the board that it's up to the doctor or it's up to the hospital. So you want to be really clear. Make sure that you know as you're going in. Question number 2, what week do you plan to induce? You'd be amazed at how many of my clients have not asked this question, and they are already at 36, 37 weeks. They hire me, I come in and I ask them, and then they say, oh, I didn't think of that. I thought I would go by my due date, or I just assumed I could go as long as I wanted, and then when the baby came, the baby came. It would be really cool if that's how it worked, but there are a lot of factors that get involved in this. You want to ask really early. Is it 40 weeks? 42 tends to be the norm of how long they can go, but you'd be amazed at how many say 40 or 41 based on other circumstances, or just that's how they do things. My suggestion is if their answer comes back as shocking to you, that you go get a second opinion at a different practice, a different doctor, switch to a midwife, get a second opinion, especially if it seems like it's something that's going to affect your outcome. Is there anything in my birth plan that you have a problem with? This would entail bringing your birth plan in. So even if you don't intend on sort of having a birth plan, you can come up with a list of things that are like, this is my top 5. This is what I want to make sure happens, even just including the intermittent monitoring, including whether or not you want to have an IV or a HEP block, including all those things that are really important to you. You want to make sure that all those priorities are discussed ahead of time. The number one thing I find that trauma will attach itself to are the things that you just didn't know were possible. So when I talk to second-time moms and we discuss sort of what happened with that first pregnancy, sorry, getting a call, you often hear things like, I just didn't know I was going to be stuck in bed the whole time, or I didn't know that if I went to the hospital right after my water broke that, I wasn't actually in active labor yet. You really want to know all those things ahead of time. No surprises. That's the goal. What is your protocol once water breaks? So if your water breaks at home, you want to know, what is my window? Do you as a doctor normally like me to come in right away? Do you like for me to have 6 hours? Some doctors don't need to see you until 12 hours. Some will allow for a labor check in their office. That way you are not getting admitted to the hospital, and that gives you all that extra time to stay home and labor and try to get things going, because believe it or not, it happens more times than I care to admit that your water breaks and then it's crickets. Not that nothing is happening, but usually it's like a contraction here, a contraction there, and now we're working to sort of get it going. But why do we want to rush to a hospital when you're not actually in labor yet? Remember, it is a very low statistic of women whose water break, especially first-time moms, whose water break and then you're racing off and you're in active labor, and that's the first sign of labor. Um, let's see, last question is there anything that you see coming up that would prevent me from using hydrotherapy? So some doctors have policies in place as far as when you can get in a tub, when you can get in a shower, if they're even going to allow it at all, if the hospital allows it at all. I once had a client hire me saying she was going to have a water birth, but I didn't think the hospital allowed it. And sure enough, when she called, they said, "Oh no, sorry, doctor told you that, but we don't allow that here." So you want to be really clear on the boundaries that you're going to have. It motivates you to stay home longer if you're able to, because you can use that hydrotherapy at home, or you get to go in there. Maybe you're bringing your own tub, or maybe your doula is bringing a tub, but at least you'll have all those answers ahead of time. Remember, no surprises. That's the goal. Thanks, guys. I am available at info@ommamas.com if you have any further questions. Have a good day.